How to care for yourself after head and neck radiation. Your registered dietitian will help you with your eating and drinking. To keep your weight the same and your swallowing muscles working, continue to eat high-protein and high-calorie soft or blended foods. Start eating regular foods when the pain stops and chewing and swallowing are easier. Return to a regular, balanced diet with foods from all food groups. Aim to drink 8 cups of non-acidic, non-carbonated, alcohol and caffeine-free fluid each day. Avoid hot beverages. Keep your weight the same for the first 6 to 8 weeks after you have finished your treatment. Your speech-language pathologist will continue to help you with swallowing. You may go for another swallowing assessment around 8 weeks after your last treatment to see how you are swallowing. Continue with the same diet until told differently and continue to follow the swallowing safety guidelines. To swallow safely, sit up straight when eating or drinking and remain sitting up for 30 minutes afterwards. Use teaspoons and take small sips of liquids. Alternate between small bites of food with small sips of liquids. Try not to talk while chewing or swallowing. And check that your mouth and cheeks are free from food after eating. You may be given other swallowing techniques to help you swallow as best you can. Follow the swallowing exercises provided by your speech-language pathologist. Do each exercise 5 to 10 times per exercise, 3 times a day, for at least 6 months after your treatment is finished. Short-term side effects of treatment may get better 1 to 2 months after your treatment is finished. Your mouth or throat may feel like it is on fire when you swallow, and you may notice taste and smell changes. Your mouth may feel dry. Carry a bottle of water with you and sip often. Your dental oncology team will help you with your mouth care. Floss at least once daily if you're able. Use a topical anesthetic rinse prior to flossing if necessary. Use a topical anesthetic rinse before brushing. Use a soft toothbrush and gently brush after meals and before bed. To clear your mouth, use a wet cloth soaked in mouth rinse. Rinse with mouth rinse after brushing, flossing, and eating. Rinse at least 3 times daily or as mouth feels dry. To make a bland mouth rinse, you will need 1 teaspoon of salt, 1 teaspoon of baking soda, and 4 cups of water. Mix 1 teaspoon of baking soda and 1 teaspoon of salt with 4 cups of water. Put the mouthwash in a container with a lid. Keep it room temperature and discard at the end of each day and make a new batch. Shake well before using. Rinse and gargle with 1 tablespoon and then spit out. Repeat 2 or 3 times at each use or as mouth feels dry. Remove your dentures, plates, and prostheses before brushing. Brush and rinse dentures after meals and before bed, and soak them in cleansing solution for at least 8 hours. If you are on antifungal therapy, soak in antifungal solution. Directions for use of fluoride trays. Brush and floss before wearing tray. Fill the grooves of the tray 1/3 full with gel. Insert tray and spit out any excess gel. Leave the tray in for 5 minutes. Use at bedtime for longer-lasting results. Brush trays and air dry after each use. Do not use hot water to clean trays. Hot water will distort the tray. Do not eat, drink, or rinse for 30 minutes after tray use. Continue to use your fluoride trays daily, or use fluoridated toothpaste to prevent tooth decay. Inform your dental team if you are no longer able to use your fluoride trays. Moisturize nasal passages through the night with a steam vaporizer in your room. Moisturize with mouth rinse and water-based lubricants often. Avoid petroleum jelly and glycerin products. Use sugarless gum or lozenges to stimulate saliva. To care for your lips, use water-soluble animal or plant-based oil lubricants often. Do not apply petroleum jelly. Your radiation treatment team will continue to help you with your skincare. Continue to care for your skin as advised by your treatment team until your skin has healed. Your skin will take time to heal. Your skin will start to improve 2 to 3 weeks after you have finished your treatments. Your skin color may take 3 to 4 weeks to return to normal. Your skin will be sensitive after it has healed. Continue to follow your skincare as outlined on the before-during radiation sheets. Wash with mild, unscented soap. Bathe with warm water, rinse well, and pat dry with a clean, soft towel. Wear loose-fitting and breathable clothing such as cotton. To moisturize skin, use unscented water-based body lotions or creams 4 times per day. Do not use aftershave or perfume products on your skin. Avoid products that contain petroleum jelly. Do not peel off loose skin, and do not scratch or rub your skin. Protect your skin from direct sunlight and wind. Wear a brimmed hat and protective clothing. Avoid extreme hot or cold temperatures. Do not use ice packs or heating pads, and do not soak in a hot tub. Use an electric shaver only. Tell your healthcare team if your skin opens or becomes wet or feels itchy. Continue to wash with mild soap and warm water and pat the area dry. Your doctor may prescribe a cream for your skin. You may use normal saline compresses up to 4 times a day. If you are having problems with your stoma, tell any member of your healthcare team. Hair loss may be temporary or permanent. Your hair in the treatment area may grow back 3 to 6 months after treatment. New hair may be thinner and/or may feel different. If you have a feeding tube, your registered dietitian, RD, and primary care team will work with you to manage your tube feeding and care. If you have a feeding tube, continue to use your tube feed and water flushes. Work with your RD to adjust your feeds as you start to eat and drink more food and fluids by mouth. Continue to flush your feeding tube with water 2 times per day, morning and night, with 60 milliliters or 1 syringe of room temperature tap water. If you are losing weight or eating and drinking less food and fluid by mouth, your RD will continue to work with you to monitor and adjust your tube feeds. Use water and nutrition supplements following your registered dietitian's advice. To care for your tube, clean the skin around your tube daily and keep it dry. Clean the skin with a cotton swab dipped in water or gentle soap and water. Wipe away any crusting or drainage. Gently pat dry with a soft, clean towel or cotton ball. If there is a leak, cover skin with a gauze bandage. If there is no discharge, stop using a dressing. Check tube for redness, tenderness, a bad smell, or signs of infection. Signs of infections include fiery red, swollen, discharge, pain, or fever. Cover tube while showering. No baths, hot tubs, or pools. Do not use rubbing alcohol, peroxide, antibacterial lotions or gels on the skin around your tube. Tell your healthcare team if you think you have an infection or any issues with your tube, or if the bumper seems too tight or too loose. Your feeding tube may be removed by your doctor or surgeon when you have kept your weight the same for at least 1 month without using your feeding tube for nutrition.